Footnote 161 of Aphorism 276. The praise bestowed of late years by some few homeopathists on the larger doses is owing to this, either that they choose low dynamization of the medicine to be administered, as I myself used to do 21 years ago from not knowing any better, or that the medicines selected were not homeopathic and imperfectly prepared by their manufacturers. Explanation of footnote 161 of Aphorism 276. We should honor and praise some homeopathic physician for their study regarding large doses and its effects. They gave reasons. The physician chose low dynamization, low potency of the medicine, or the medicine selected were not homeopathic and imperfectly prepared by their manufacturers. Footnote 162. Thus, by continuous use of aggressive allopathic large doses of mercurials against syphilis, develop almost incurable mercurial maladies, when yet one or several doses of a mild but active mercurial preparations would certainly have radically cured in a few days the whole venereal disease, together with the chancre, provided it had not been destroyed by external measures as is always done by allopathy. In the same way, the allopath gives Peruvian bark and quinine in intermittent fever daily in very large doses where they are correctly indicated and where one very small dose of a highly potentized China cinchona would unfailingly help in March intermittents and even in persons who were not affected by any evidence psoriatic disease. A chronic China malady coupled at the same time with the development of Sora is produced, which, if it does not gradually kill the patient by damaging the internal important vital organs, especially spleen and liver, will put him nevertheless suffering for years in a sad state of health. A homeopathic antidote for such a misfortune produced by abuse of large doses of homeopathic remedies is hardly conceivable. Explanation of footnote 162 of Aphorism 276. The continuous use of aggressive allopathic large doses of mercury and its different preparations for the treatment of syphilis give rise to incurable diseases, but one or several doses of mild but active mercurial preparations would certainly have cured radically in few days the whole venereal disease along with chancre, unless it had not vanished by external local application as always done in allopathy. Same way in allopathy, physicians give Peruvian bark and quinine in intermittent fevers daily in large doses, while one small dose of highly potentized quinine, wherever it is indicated, would cure and would cure same intermittent fevers and even in person who were not affected by an psoriatic disease. The diseases produced by China, especially its large doses with development of SORA, will gradually kill the patient, or it will put the patient in a very sad state of health with sufferings of years by damaging internal important vital organs, especially spleen and liver. A homeopathic antidote for such a misfortunately produced maladies by abuse of large doses of homeopathic remedies is very difficult to get and sometimes it's not possible.